Today we like to talk about neuropathy. Neuropathy become more common in South Florida because there are a lot of retirees come to South Florida. They actually permanently move here from New York, California, because the taxes are here good for the retiree, right?
Oh yeah.
So, Bob, you don't have neuropathy and you have had a type 2 diabetes for how many years?
Probably had type 2 diabetes for maybe 30 years. And I do see a doctor that they specialize in foot and ankle diseases. So because I have type 2 diabetes, my insurance pays to have my toenails clipped. And once every 5 years, the insurance company will also pay for neuropathy testing. And I have done that twice with this company, and the results are negative and show that I don't have anything even in early stages of neuropathy.
So I try to figure out and tell people how to avoid neuropathy, because from my over 30 years of clinical experiences, not only people with diabetes have neuropathy. I noticed that people have like other circulation problems, like low blood pressure, renals, and anything influence the blood flow to your feet and hand could lead to neuropathy. And I also noticed that people who have hip replacement, knee replacement, and after that, they tend to develop neuropathy. Of course, chemotherapy definitely will lead to neuropathy. And so, what's the reason causing you have no neuropathy? And I was thinking, because you constantly move, you cook your own food, and that's give you sufficient nutrients, healthy diet, and then also you do yard work, you clean your own house. So all of these activities keep you moving during the daytime, right? You don't sit for too long during the daytime. Even in this hot weather, you go out to organize your yard, and that will push the blood to your feet, and that will prevent the degeneration of the nerves. So I hope people learn from you to prevent neuropathy, because neuropathy is it's tingling, numb, and also once you lose sensation, then you couldn't feel the ground, then people tend to fall, and they even didn't know how to fall because they didn't feel the surface of the ground.
Yeah, I see people that wear the socks that come up basically to the knee and add some support to the lower part of the leg. Is that to help with neuropathy, or is that
I think
a circulation problem?
It helps the circulation, especially varicose vein, when they walk. If they don't move and sitting there with that compression socks, it's even worse. Because if you don't move, your blood will not go back. It's old blood accumulating there without sufficient oxygen, without sufficient nutrients. So movement is the key. Even though you have to use walker, use the cane, you have to move. When you move, your muscle gets stronger, and also your circulation gets better.
Yeah, I do at night. I watch a certain amount of television, and even with my streaming, I pay for the ones with the commercials, because that gives me
Discount.
Right. Pardon me?
Discount.
Yeah, well, it's cheaper, yes, and also it gives me an opportunity, maybe get up, walk in the kitchen, wash a couple of dishes. So rather than watching like a movie without any commercials, I'm going to be sitting there for an hour and a half. So I like the commercials. I don't see them, but I use that time to get up, move around, and do things that I have to do, in the house, or I might even go outside and take a quick walk. But
I have one suggestion, because recently you had back pain. So if you're watching TV, and I recommend you to lie on the sofa or on the bed with leg elevated, but not reclined position. It's the position that you lie flat with leg elevated. That way you can balance your muscle, relax your muscle. Because sitting is the worst position. Even standing, people have standing desk, but you're not moving, your muscles still get tight. So people ends up disc problems. So lying down is a very luxury position nowadays. So if you're watching TV, just lie down and stretch while you enjoy your show.
Yeah, I have an exercise bike that is in my living room, and I try and get on the exercise bike where I can still watch television, so I'm getting some entertainment, and a lot of times I don't even realize that I'm on an exercise bike. So there's many things that people can figure out on how to get a little more moving than they would be normally at an old age.
Thank you.